Hey YouTube, it's Leah, and I'm really excited to be doing this video today because this is a topic I have wanted to do a video on for a while, and I just really haven't had, I guess, the courage to tackle the subject. And the subject is regain. And as someone who is just post-op 2 years, it's something that has happened. And I've watched a couple of videos recently on YouTube that really talked about the topic of regain and how it's normal. And Fat King's TJ said, like, get the fuck over it. It's gonna happen, people. So anyway, so here we go. For any of you that follow my channel, my highest recorded weight was, I had vertical sleeve gastrectomy surgery December 4th of 2012. My highest recorded weight was 260 pounds. My date of surgery weight, I can't remember, 218, something like that. And my current weight today is 138 pounds. And my lowest weight was about this time last year, and that was 122 pounds. So math-wise, what is that? A gain of 16 pounds? So for a while, I've kind of watched the scale trickle, 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 trickle. It would get to like 129 and I'd freak out going, oh gosh, I'm getting in the 130s, like, yippee. Then it started 135 and then it was like 140 and I'm like, what? Halt. So I guess a couple things with, and again, this is just my opinion. It really probably doesn't mean shit. It's just I'm expressing my opinions and my views on the whole regain topic. So it's proven that weight loss surgery patients within the first 12 to 18 months pretty much are going to hit their lowest weight, and then it is very normal, and your surgeons, the bariatric surgeons, expect most of those patients will regain an additional 10 to 15%. So, if you've lost 100 pounds, more than likely you're going to gain 10 to 15 pounds from your lowest weight. This is not stuff I'm making up. This is all over the place, okay? Scientific fact. So when I talk about being at my lowest weight of 122 pounds and then I talk about being today 138 pounds, I'm falling right in where, what is considered, and I hate the word normal, but what is considered normal for a weight loss surgery patient, 2 years post-op. And I guess for me, part of it is this feeling of disappointment. Feeling like, gosh, people are probably thinking I'm going to gain all my weight back. Or, I don't know. But I really thought long and hard about it for the past couple days. And when I was at my lowest weight, like I said, about a year ago, at 122 pounds, I was in a size 0 to a 2. Size extra small tops. And if you go back and look at a lot of my videos from last year, I complained that people were saying I looked too thin and, you need to stop losing weight, and I was saying I didn't get it, and what are these people talking about? I'm totally healthy. And wow, what a difference a year makes, because when I go back and look at those videos, I think that I was too thin. I think that my face was very gaunt looking. I was very bony through here. I see it now. And I didn't see it then. And I was healthy. Don't get me wrong, but I now look at how I looked at my lowest weight, and I don't want to go back there. I don't want to go back to 122 pounds. Do I want to be 138 pounds? No, not really. At today's weight of 138 pounds, I am in a size 4, 6, size small tops. And I do want to be able to get back into some of the clothes that I was wearing before. However, I want to do it on my terms, because I've talked in length about laying a good foundation to be a successful weight loss surgery patient. And I've done all those things for the most part. I'm really good about tracking my food. I still weigh my food a lot. But I feel like at 2 years post-op, the way that I'm living as far as my food, I could do for the rest of my life. So having said that, if that was the case, then theoretically I should be able to maintain a weight of, 138 pounds, give or take. And I should be fine with that. A size 4, 6? But the crazy part is that my mind is so fucked up from being fat so long that I now think, because I'm in a size 6 jean, that I'm fat and that I look fat. And that's a scary place to be. And it doesn't have anything to do with the scale. It has everything to do with my brain and the things that for 2 years I've worked on so many things, mentally, physically, but I really think that I may have some kind of like body dysmorphia. I don't know. And it's sad. It sucks, because I should be thrilled at the way I look. I look back at my pictures at 260 pounds, and if I knew this is what I was going to look like today and never lost another pound, I would have been freaking elated. But this whole weight loss surgery journey I talk about, it's crazy, and it's a mind fuck. It is, people. So one of the things I see a lot of people talk about with regain is I think it's normal to freak out thinking you're going to gain all the weight back. And yes, does that happen to people? Absolutely. I see it. I've heard about it. And I'm not scared about that. I'm not scared about regaining all the weight that I've lost, because I know that I've made lifestyle changes that it would really be virtually impossible for that to happen. I mean, I would literally have to stop everything I was doing. And I just don't see that. I just don't see that happening. But I see the things that people are doing, the pouch test and paleo diet, and I'm not judging those people. I mean, if that's fine, if that's going to work for you, but it's, for me, I'm not willing to take those extreme measures, because I want a realistic approach to something. Let's find a permanent solution, not a 5-day pouch test, okay? Because your weight's gonna fluctuate from day to day. So what I'm here to say today at my regain I do want to lose about 5, maybe 10 pounds. And Fat Kings TJ said something funny. He's like, don't y'all remember when you were fat and, you know, you had to lose like 150 pounds and you would talk to, you know, people and they'd say, oh, I really need to lose some weight. And you'd be like, oh, yeah, how much do you want to lose? And they'd be like, oh, 5 or 10 pounds. And you're thinking, you're an asshole. Really? I would love to be able to say I only had to lose 5 or 10 pounds. I need to lose like 100, 150. Well, guess what? We are those people now. Really? I mean, come on. So I am not going to bitch and complain that I want to lose 5 or 10 pounds because people, that is, and you know I hate the word, normal. Every day. People go through this every day needing to lose 5 or 10 pounds. So I am not going to bitch and complain about it. I'm not going to freak out. Like TJ said, calm the fuck down. I love him. And TJ, I don't think you're an asshole in the community, by the way. I think you speak it straight up, and I applaud you. You tell it like it is, and some people just don't want to hear that. They don't want to hear truth. They just want to hear fluff and unicorns and roses blowing up people's ass. So, anyway, so with the regain, I'm not going to bitch and complain about 5 and 10 pounds. I know what it takes to get to where I want to be. It's just mind over matter and how bad do I want it. And honestly, I think for me, it's, you know, I struggling with the low iron, not being able to work out like I was. I'm sure that that's, you know, that hasn't helped me to not, you know, pack on the pounds. I say pack on the pounds. It hasn't helped me to maintain a lower weight. So, I'm not going to do a pouch test. And I am not going to do anything crazy or extreme. I am just going to start slow and steady. I'm going to get back to, even if it's just walking, even if it's just getting on the elliptical, because I felt better about myself when I was working out. I didn't feel as flabby. I felt firm. And I felt better. And that's where I want to get. I want to get to feeling better. And again, it's, you know, really not the number on the scale, although I'm not going to lie, that scale is a mind fuck. I hate it. It will always be. I just have to accept that. But I also want to feel good about me, feel good in my clothes. So it's just doing what you got to do. And that's what I'm going to be doing. So, yeah. So I kind of probably carried on as usual. But again, I've seen so many videos about the regain. Like I said, I mean, part of me was kind of disappointed to come on and say that I had regained, but really, why should I be disappointed? I have been a tremendous success. I have changed my freaking life, and I look good and I feel good. Could I feel better? Yep, I could, and that's what I'm going to do. So, before I leave, I know this is a really obnoxious sweater, and this is kind of one of those non-scale victory things, something that I would have never worn when I was heavier. 2 things. I would have never wore the sweater because it's really ostentatious. I also would never wear the jeans that I'm currently wearing. I'll show you. Okay, let's see if I can do this. Let's see. Okay, so let's see if I can step back enough. Oh, you can't really see. Okay, well, anyway, the thing I want to show you is I have pockets. Flat pockets on my butt, and they have glitter. Oh, yes, I would have never worn that when I was heavier. Now, these are a size 6. And again, here I'm thinking I'm fat. I'm even looking at the video right now going, what are you doing, Leah? But I know I'm not. I know that's not true. I'm proud of where I'm at today. And so I just gotta get back on the bandwagon of getting in some exercise and cutting out the nighttime snacking, but I know what I gotta do, and it's not anything extreme. So just be proud of all the, I guess what I want to say is I think so many of us focus on our faults, and I do it every day, but so many of us need to just think about, we need to be proud of ourselves and look how far we've come. And it's awesome. So, anyway, I've ranted long enough. Okay, I feel better now that I've gotten that off my chest. All right, take care, guys. Have a good weekend and stay safe. Bye.